Hello everyone, today's video is another Q&A video. Questions today about urinary tract biofilms, DMSA dosing, what else do we have here? Little tidbit about COVID, and let's see here, and then using MSM as high-dose sulfur therapy for patients who have been floxed. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And if at some point you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I would really appreciate it. So thanks in advance for taking a second to do that. So the first question I have up here is on one of my videos where it's called Why I'm Excited About High-Dose Sulfur Therapy Using MSM. And I'm still very excited about using high-dose sulfur therapy using MSM. It's really great therapy. Just this week alone, I've had a few other patients follow up saying how much it's been helping with their chronic digestive issues, or a couple of patients this week specifically with chronic digestive issues, one with chronic pain issues. So really loving this therapy, just very exciting. Prescribing it all the time. So if you yourself have used high-dose sulfur therapy by using high-dose MSM, please consider sharing in the comment section. Let us know how that's been going. I'd love to hear about that. Or if it hasn't been working, I'd like to hear both sides of the coin. So the question here is, have you had success using this with your floxed patients, so patients suffering from fluoroquinolone toxicity? So unfortunately, I haven't, just is what it is. I haven't had any patients, any floxed patients who have used high-dose sulfur therapy to date. So that's the short answer. I did want to talk about it a little bit more though in the video, just saying that I do think it would be something that I would strongly consider the next time that I have a patient who's floxed. Thankfully, my patients who have been floxed have been doing well. We just haven't gone there at this point with MSM. I haven't had any recent new floxed patients, so I just haven't had a chance to try it. That being said, I do have one patient who was floxed, actually. I had one patient who was floxed who tried it, and unfortunately it caused him to flare up quite a bit, even at a low dose, and tried it like at some very low dosages and actually caused him to flare. Now this patient, he has this propensity to unpredictably flare from things. So, sometimes antioxidants will flare them, sometimes they don't. Sometimes certain B vitamins flare them, sometimes they don't. So it's maybe not the tends to be a little bit unpredictable in terms of what he's going to react to, and then some things he just consistently tolerates really, really well. So he's maybe not the ideal prototypical example to use, but that's been my limited experience so far. But on paper, it makes a lot of sense that the MSM could be really helpful in patients who have been floxed. So I will have to post about that when I have more data. But if anyone who has been floxed happens to have tried high-dose MSM, please let us know how it went if you are comfortable sharing that on social media. Next question here is, let's see, what was this video? So a video called oral versus IV chelation. And so I've spoken there about oral chelation in the form of using something called DMSA. And the question is, how many times a day is DMSA given? The DMSA protocols really vary. In my practice, I usually just recommend that folks take it once a day before going to bed, typically, which is when we have most of our detox function happening, to my understanding. There are some protocols, I don't think I've ever heard of a more than once a day dosing of DMSA protocol. There are protocols I used to follow where you'd be on DMSA for, say, 3 days on, 11 days off, or a certain number of days on, a certain number of days off, 1 week on, 2 weeks off. There's these pulsing protocols. And then I heard this lecture, I believe it was Dr. Joseph Pizzorno. I could be wrong on that, but I believe I heard a lecture at a conference, and he was talking, and I'm not trying to speak for Dr. Pizzorno here, but I believe that he was, if it was him, it's many years ago now, but I believe that he was talking about just, dosing DMSA kind of at a lower, because for context, when it's, say, 3 days on, 11 days off, or X number of days on, X number of days off, it would typically be a much higher dose, like a fairly high dose of DMSA, kind of dosing like kind of the maximum for a patient's body weight on those days on, and then taking a bunch of days off to give the body a chance to kind of recover. He made a really good case for just giving a lower dose every single day, and I've done that ever since, and I found it works just as well, if not better, with those. I would say it works better in that it seems to be less prone to flaring patients up. Not that the other pulse dosing was causing flare-ups all the time, but I did have more flare-ups happening in kind of using the old method, the pulse method, than I did with this method. So I've been really happy with that. But I've never heard about it being given more than once a day. I'm not saying it's not a good idea to do that, but I haven't heard of that or seen that myself. So thank you for the question. And then let's see here. So the next one, one of my more popular videos called Biofilms, Best Disruptors and How Long They Take to Work. 7,700 views so far, 69 comments, so popular one. So this one says, what about UTI biofilms, so urinary tract infection biofilms? How long, which product? I've tried everything under the sun. Olive leaf, curcumin, D-mannose, phase 2 biofilm from Signature Supplements, corn silk tincture, colloidal silver, oil of oregano, etc., etc. It's so frustrating. Someone said that Kirkland biofilm disruptors are also good. Please help. So yeah, thank you for the question. Sorry to hear you've been struggling with this so much. I mean, of the things that are listed there, some of them are really not biofilm disruptors. Some of them are or if they are biofilm disruptors, they're kind of phase 1 biofilm disruptors. Phase 2 biofilm disruptor from Signature, it's a pretty strong one. It doesn't have the chelating agent in there, so I wouldn't say it's the strongest of the strong, but it's a pretty good formula. Sometimes with biofilm disruptors, it's a matter of taking a high enough dose for long enough, so that's sometimes a factor to consider. As per usual, I can't talk about dosing on social media, so it's construed as medical advice, or could be construed that way, and I'm not allowed to do that. So can't give any more detailed information than that, but making sure it's a high enough dose for long enough, that can be important. With colloidal silver, as I've talked about in a number of other videos, a lot of colloidal silvers out there, especially Canadian companies, and given that you're taking phase 2 biofilm from Signature Supplements, I'm assuming you're a Canadian because they're a Canadian company. Most Americans and other folks in parts of the world have not heard of Signature Supplements because they're not an international brand as a rule. So a lot of the colloidal silvers, especially the ones in Canada, are only 10 or 23 or 30 parts per million, maybe a 50 parts per million if you get lucky. The colloidal silver, or silver hydrosol rather, that I like to work with is 200 parts per million. So depending on the dose that's being used, the concentration of the silver, that could dictate whether or not that was helping, and also the length of time it's being used for. And then, yeah, I mean, so that those are, as far as biofilms goes, those are a couple of important things to consider. The other side of it is testing being done to see, is there actually a persisting infection happening? Has testing been done before and after the biofilm disruptor was given? There's this company called MicroGen DX, just micro like microscopic, gen, GEN like generation, and then DX like D as in Douglas, X as in X-ray. I think it's probably a .com if memory serves. And so they have tests, and actually folks, just the general public, can test through them, which I like, because I'm not a big fan of gatekeeping when it comes to testing and folks spending their money on what they want to test. But anyways, that's my little thought there. But anywho, they run, in my opinion, like really state-of-the-art testing to see if there are sometimes like really difficult to detect microbes kicking around in urine samples and in other samples like vaginal swabs and prostate excretions and things like that, to look for the kind of hidden genitourinary tract infections. And so yeah. Anyways, a few follow-up questions there, I guess. But do we know that there's microbes? Which ones are there? Are the right antimicrobials being used at the same time? But generally, the strongest phase 2 biofilm disruptors are going to be your silver, your chelators like DMPS, EDTA, and then the business thiol complex. That dithiol complex, rather, the bismuth ALA complex that's in phase 2 biofilm disruptor. I'm not sure if Signature actually has the dithiol version. I'm not really sure about that. But I think there's a company called Prescripticist, maybe. Oh, geez. No, what are they called? I can't remember now. Anyways, it's called phase 2 Advanced, I believe, is the product. I can't remember which company makes it now, or a compounding pharmacy can make that really strong biofilm disruptor. So anyways, I hope you find some solutions soon for the challenges that you're experiencing. Very quickly here, just in the last few seconds I have, someone had posted a comment here just on one of my videos where I talked about some details around long COVID. And so I'm going to just paraphrase here, but basically I had COVID 3 times, just had the 4th last week. This time it was gastrointestinal, diarrhea, nausea, zero appetite, lasting a dull headache. Basically the patient took, this individual said they took ivermectin, and within an hour, like the symptoms were 90% gone, which is just amazing to hear. So I'm just, so happy that, found a successful treatment. Really, really great to hear. Any questions or comments, just post in the comment section below and I'll do my best to answer ASAP.